Good morning, everyone. I'm going to be showing you how to properly administer a sub-Q injection. There are two types of sub-Q injections. You're going to have your insulin, which you use a U100 insulin syringe, or you're going to be having other medications, usually heparin, that you will also be administering, and for that you would need like a 25 to 28 gauge needle that's about 5/8 of an inch long. So according to best practice, you're not going to administer more than 2 milliliters at a time in an adult. You can use 2 injection sites if you need to administer more than 2 milliliters. So first we are going to gather our supplies. You need your syringe, an alcohol swab, your medication, insulin or other things. Today I'm going to be using insulin, a bandage, and gloves. So first you are going to prepare your medication, do hand hygiene. You're going to want to make sure that you check your medication against the MAR to make sure that it's the right medication and the right dose. If you're preparing insulin, you want to make sure that you check their glucose before. There is going to be patients with a sliding scale in which you want to check their glucose, check the MAR, and it's going to tell you how much insulin to administer. Other times they're going to have a specific amount that you're going to give, and that's generally going to be your long acting or other types. Your rapid acting is generally going to be your sliding scale, and that's usually going to be given before a dinner, lunch, breakfast, etc. So take your alcohol swab. Now technically this is a normal saline, but you're going to have your insulin and you're going to clean the top. Then take your syringe, your needle, you're going to poke it through, you're going to bring it up like this. Get a grasp on it, however is best for you to hold it, and pull out the correct amount of units. Now this is going to be in units and not in milliliters. If you're doing another medication, it is going to be in milliliters. So you're going to want to make sure that you're not using an insulin syringe for another medication or another syringe needle for insulin, because those measurements are not the same. Now you pull out, and sometimes to get rid of bubbles or air pockets, it's best to pull out more, and then you can push back into the bottle to make sure that you are getting the correct amount. Pull out. Now if you're doing this outside of the room, you are going to make sure that you label so that you make sure that you are giving the correct medication. Now that we are done preparing our medications, we are going to enter the room. So you're going to go into the room and you are going to introduce yourself to your patient, and then you are going to make sure, I don't think this mannequin has a wristband on, but you're going to want to check your wristband with 2 identifiers. You can usually say, can I have you repeat your name and your birth date? And they will. And you can either scan it if you have a scanner, or you can check it verbally against the MAR, and that's going to be your 2 checks. So then, hand hygiene again. Get your gloves. And you want to make sure you educate your patient and assess their allergies. So you would say something along the lines of, "Hello, Mr. Smith. I'm going to be administering your insulin today. Do you have any allergies that you'd like me to be aware of? No? Okay, so your insulin is going to bring down your blood sugar. Your blood sugar is currently blank, and I want to make sure that you know that it could produce some side effects like hypoglycemia. And so if you have any signs and symptoms of hypoglycemia, I want you to get on that call light and I want you to call me. Otherwise, I'm going to check back in with you after. You're going to find your location. So that's usually going to be on the shoulder here, on the stomach, or on the thighs. Today we're going to be using the stomach. So you're going to uncover just where the stomach is. And so I'll bring this closer. You're going to assess to make sure there are no bruises, masses, so you can palpate if you want, or anything that would make you not want to give your insulin there. So then you're going to find your spot. I'm going to go right here, and you're going to clean and wait for it to dry. And you're going to take your syringe. You're going to pinch the location and just dart it in at a 90-degree angle. Then you're going to push in slow. Unpinch, take out, apply your safety, and then you can apply your bandage. Clean up all your materials and let your patient know that you will be back to check on them in 15 or 30 minutes to make sure they are not having a reaction. Okay, so when you have your needle, just to add, when you've taken the cap off, drawn up your medication, this is how you put the cap back on to bring it in the room. You're going to scoop, and then at the bottom, put it back on. So that it's secure. And then you bring it into the room. That's when you're going to do your 3 checks, or your last check with the MAR. And then you can take the cap off. Administer your medication, and that's when you put up your safety and you're going to throw it in a sharps container.